Welcome to a lunch and learn session for assisting your students overseas, dealing with mental, emotional, psychological issues, and especially the other even medical issues that figure into it. A couple things. We are not going to, in this next hour, train you to be psychologists, therapists, or counselors. So it takes at least, what, 2-3 hours to do that?
I've seen 7 years.
Oh, okay.
That's how long it took me. I don't know.
But what we want to give you is some practical information when you're dealing with students when you're traveling abroad. By the way, I guess I ought to tell you who I am. I'm Michael Swayze. I'm the director of the International Risk Mitigation Department. Basically, I'm the guy you guys call when something goes off the rails overseas. So I get probably 10 times more phone calls about a student having emotional or psychological issues when they're overseas than I do somebody with a broken leg, somebody who was assaulted, or somebody who's missing. So, to me, this is an incredibly important topic to get on top of. One thing that you'll find is that, one thing I'm hoping you'll get out of this is that you have a lot more power, a lot more freedom to find out things ahead of time, dealing with the students, talking to them, than you might think you have. And so we want to help you prepare for it, deal with the issues, and then make your programs more successful because of it. And in that, we have doctors, Josh Gunn with Psychological Services, and Megan Bowles from our health unit. So I will turn it over to them.
Okay. So, hi everybody. I'm Dr. Josh Gunn. I'm a psychologist. It takes 7 years to be a psychologist, not 2 or 3 hours. I just want to clarify that. I've been at KSU about 9 years or so, and so I've been on the receiving end of a lot of study abroad conversations around what we're doing with challenges abroad. And I say Meg and I are part of kind of the brain trust that Mike and others bring in when we're having issues abroad and stuff. And so we work on kind of this side of working with a lot of those things. And so we're hoping to kind of talk with you guys just some of the things that we feel like faculty and staff who've been going abroad don't always have at the forefront of their mind as they're kind of preparing to go abroad and things like that. And so we're hoping this will be helpful. So, one of the main ideas that we wanted to kind of elaborate on this afternoon, I guess, is just this idea that preparation, planning, and preventing problems while traveling abroad are all kind of a singular process with different parts. And that the more that you can do on this side, the more that you can use the information that you know about students and their functioning and how they're doing over here and kind of prepare both yourself and them for what's coming can serve you greatly in preventing problems, for getting above and beyond kind of what you hope for and what might be negatively impacting just kind of the education abroad experience. So, one of the things I think we've worked with Education Abroad with over time to do is try to get as much information about students as possible before they go. Students, everybody has a different tolerance for what they want to share about themselves, and they have that right? Just like when you go to a doctor's office and they're like, check all these things that you've been in your family history. You can opt out of all of those if you don't want them to know. And so students can do the same with us. But we do find that students tend to be fairly disclosing. And so a lot of times they're very open about kind of things they've either struggled with. And so there is a good bit of information that you can kind of take a look at as you're looking at the group that's going with you, and kind of get a sense of, well, this raises a couple questions for me, this raises a couple flags. Is a conversation with the students a way that I can find out more about that? Are there other places on campus that I can consult with about kind of how to help best prepare the student to go? And so that becomes a big part of that preparation and planning phase of the travel, is kind of just learning who's on your trip, and not just what classes they're taking and what their grades have been, but what else are they telling you about their life that might be exacerbated by an inherently stressful event, which education abroad is. So, and like Mike said, we don't expect folks to be kind of therapists or doctors or any of that kind of stuff when you're over there. However, there is a different, I would say, role that you are in when you're not here on campus and there are these other things here. And so, there is that responsibility to be paying attention, to be curious, to be interested, not just what's happening in the classroom or on their assignments, but in their kind of general functioning. I mean, the university as a whole here develops people, as well as develops, their brains and all this stuff we're learning. And so when you're in that role abroad, there is an expanded capacity there of needing to know not just what's happening with them, like while they're sitting there in class, but kind of in general. Because I think, kind of like Mike said, it's rarely that we get calls about like this happened in class. That's usually not the call we get. It's this happened after class, this happened on this excursion, this happened in the hostel or hotel they're staying with, this happened with their roommate. And so those tend to be the kind of things you guys are reaching out for us for input on. And so that's the kind of stuff that you also have to be thinking about and paying attention to. And so, one of the things that I feel like sometimes faculty and staff, I feel like they're hesitant to ask some basic just questions of curiosity about folks. And so I just wanted to kind of remind you that it's not an invasion of privacy to inquire about students' lives and inquire about things that might impact them while they're away. And I think sometimes, especially faculty, tend to kind of box themselves into, like, I can only ask them about their academic life. And that's not all that's going with you over there. And so there's no reason that you can't engage them in conversations about their personal life, about how they're doing, about their well-being, about concerns they have, or anything like that. It's not an invasion of their privacy. Now, again, they have the right to be like, I don't want to talk to you about that. But we tend to find that most students are pretty open. And when you do that, I think one of the things that it really helps do is it just sets a foundation for you as being someone that they could come to before a problem's big. It sets a foundation for you being seen as someone who is curious, who's caring. And if something starts to go off the rails, they can come to you before it's flying off the rails and taking the rest of the program with you. So I think that could be very helpful. And I'll talk a little bit more about kind of like FERPA and stuff like that, but there is a good ability for folks who work with students to share information. And so you guys have the ability to talk to each other, to talk to people on campus, to talk to the other people who are working in the program, to find out information that would be helpful to a student. And that's perfectly acceptable stuff to do. And so kind of just one of the last things, going back to this idea of, here on campus, there's student affairs, there's residence life, there's dean of students, there's health clinic, there's counseling center. None of that exists in most of the places you're taking students. And so there is a different, capacity. Like, we have different access to them, they have different access to us as resources, and we tend to have fewer eyes on them. And so that goes back to kind of being that curious person about your students. Like if you have a problem in your class now and something's going wrong with a student, a lot of times we'll check in with their other faculty or check in with their residence life staff to be like, so what are you guys seeing? Is this a more pervasive pattern of behavior? But over there we tend to have less of that. And so there is a kind of just differential ability to observe, for students to access things on their own. And so it changes the role, I think, of education abroad faculty advisors. So I'm going to turn it over to Matt.
So before Josh really gets into the mental health aspect, we just want to talk a little bit about how your physical health affects your mental health. And just before we assume that mental health is primarily the root of kind of what's going on, we just want to touch a little bit about mental health. And I look at travel abroad, and when we're talking to students who are potentially going abroad, and I know you're all aware of these new forms the students had to fill out for their upcoming trips, because you had to fill out your faculty part. How I talk to a student about travel abroad, and some of the students are easy, right? They don't have a lot of past medical history. But even those students, I talk to them a lot about travel abroad is another transition period. It's a lot about like when you came to school as a first-year student or as a freshman. Because when you travel abroad, whether you have no medical history or you have a chronic illness, it's going to be a big time of transition, and you know this. There are going to be out of their support system, out of their comfort zone. So what you may see is, let's talk about the student who doesn't have a past medical history. They may get over there and be in their second week of the program or even the second day of the program, and they may get a simple sore throat. And truly, without sounding funny or condescending, they may have a complete emotional breakdown that they have a sore throat. And you know, we've had students sometimes have a really severe stomach flu and start spiraling downhill, and then you find out they have a history of depression and they have suicidal thoughts, and this all actually stems from, it's not really a flare-up of their depression, it is all stemming from this horrible diarrheal illness that they didn't want to tell anyone they had, and it now is flaring up all these old suicidal thoughts. And it's really, we see this all the time during first year transition here, and it's that this is the first time they're away from home, potentially without a parent or whoever was their support system, or they're not sure how to go to a pharmacy and find the Mucinex D that they always take for their sore throat. So that's the student who doesn't have any past medical history, and now they're without their support system. You know, and some people deal with getting illnesses well, you all know those people, and then there's some people that get a common cold, that get diarrhea, and truly cannot handle it well. And so sometimes before you start thinking, you know, is this person having, you know, first find out, are they physically feeling well? You know, is something else going on that they just don't feel comfortable? Some people have no problem telling you they've been throwing up, they have diarrhea. A female, I don't know, she forgot her birth control pills and her period has come unexpectedly. Some people feel fine telling you that. Other people, you have to like pull it out. Even in the office, they're in my office and it's like, I've been in there for a half an hour over knee pain and it comes out something else has been going on. But then you have the students that have a past medical history, and this is someone that maybe you did know they have diabetes, type 1. We have a lot of students with type 1 diabetes, or Crohn's disease or asthma, and it's been perfectly controlled, and they're so proud of themselves. This is your type A student, never had a problem with diabetes, but now they're in Italy or Greece, and they're eating something different, and they've been a perfect carb counter their entire life, and something is throwing it off, and they're not a perfect carb counter, and they don't understand why their blood sugar isn't perfectly controlled, and you think all of a sudden they're having major anxiety or depression, and really they're not. It's that they're beating themselves up because their diabetes isn't perfectly controlled. So just to try and think about kind of the layers of what may be going on. Maybe they're not really homesick or hating the trip or having anxiety attacks. It's really that this underlying illness is coming out. So as Josh was saying, if you know some of this history about the student, it's okay to ask if you know that they have diabetes or asthma. You know, how's that going here in Italy? And people who want to talk about their health will talk to you about it. And it's very easy to see. You all have friends that like to talk about things and don't like to talk about things. And it's very easy to see who wants to talk about it and who doesn't. But just to try and remember that it's all very interlinked, people's physical health and their emotional health, but especially being overseas. Some of these and chronic illnesses, it's very easy for very quickly, within 24 to 48 hours, for those perfectly controlled chronic diseases to no longer be perfectly controlled, especially with changes in sleep and changes in time. So I would encourage you to bring that up if you know a student has any of those chronic illnesses. Just to touch in if you see that something's just not quite right with those students. And that also touches to the necessity and why we're excited about the pre-travel visit is just to remind the students about medications. Because we see this time and time again on the, we get reached out, Josh and I do, about students not being adequately prepared with enough medications for their travel. So the more times you meet with students before they travel, whether you're having pre-travel visits, emails, communications, I cannot beg you enough to remind students to meet with whoever their providers are, to have enough and extra medications. Not just for what they're on daily, but you don't need to to get into it, but just remind students too, if they, whether it's something they take daily or if it's something they take as needed. Those as needed medicines need to go with them too. If they have asthma medicines that are as needed, assume you may need it. And then we have a lot of students who assume they can get all their American medicines in all countries, and as we all know, that is not true. So that's probably one of the biggest things Josh and I and BRT hear back from that students are not doing well somewhere because they were not adequately prepared with their medications. So if you can help us with that, we would love it. And then we just wanted to touch briefly on too that, if you are aware, that students are having, and as Josh will kind of go through different signs of mental health, that we always want to assume that, we don't always want to assume that what appears to be mental health is not always mental health related. Over the past couple of years, we had someone that lots of people had assumed, that she was having manic episodes, and she was actually floridly hyperthyroid. So drug abuse is another one too. We have had other times where people were assuming, that someone was manic or was having panic attacks, and instead it was, some stimulant use or cocaine abuse. So just, have other things on your radar. It's, that is just so if you're worried about someone, there could be lots of things going on. And so it's always okay, as Josh will walk you through, to ask lots of questions. But if you do know that someone is going with a physical, chronic medical illness, I would just always say to just, ask, how's it going with whatever that is, diabetes or asthma, now that we're here. And you will very quickly realize who wants to talk and who doesn't. But, and then I think, Michael and I have been just talking about just feel reassured that when you see students that it appears they're having, not major, but anxiety and depression, really from what appears to be a mild illness overseas. We really see that, and I can't stress it enough, in the first month or two here of school as students transition. And we commonly see that a lot in the first year here, and it's just being out of your comfort zone. So the more you can take on the parental role or the older sibling, however you want to look through it, and essentially just help kind of nurture them through that illness. And I think I already went through the medication spiel from my last slide, but that's the biggest thing I think you could really help a lot of our students with in all your pre-visit meetings. If you can just constantly, it's hard, I know the forms that we did for the pre-travel visits are helpful with this, but they're so far out. They were due, I think most of them were due a good 4 to 6 months before your trips were planned, so that at all your touch points with students, if you can just help remind them, because obviously they're going to need to get them filled just before they travel. That's probably been our biggest, I would say our biggest follow-up kind of lesson learned with a lot of our recent BRT cases.
So one of the things I was thinking as Meg was talking, one of the adages we kind of operate from in my world is that sometimes we have to give students permission to talk about things, and we give them permission to talk about things by bringing them up first. And so I do think it is on the faculty and staff who are doing some of these things to have mentioned that medical problems and things like that are something we can talk about. Mental health stuff is stuff we can talk about. Medications are something we can talk about. Just so that they kind of know that this is on your radar too. Like, as you know, and you can do it very easily, I think, by modeling like kind of how you're thinking about your own health. Like I'm taking care of myself by doing these things and stuff like that. And so giving students permission to talk about these different sides of their life. And not that you want them to come talk to you about it all, but to know that if they need to, if it starts to spiral, they're not holding it until they just can't anymore. They're coming to you so that hopefully we can prevent it from getting worse than it needs to. So I think I've already hit on some of these ideas a lot, but we'd just like to reiterate this often, because a lot of times when we're on the phone or video conference with faculty abroad, a lot of the hesitation we see is in their comfort, and I think it's more comfort than anything, on just having conversations with students that aren't directly related to assignments in their classroom. And just being willing to be, the kind of person, honestly, you'd be with your best friend, or a family member who came to you with a problem, that you would just naturally be like, oh, well, let me ask you some questions, let me see how I can help with that. It seems like that part of their brain is like shut off because this is a student, and that part of your brain just can't be shut off, shouldn't be shut off, and especially when you're over there and they're, like I said, away from their normal support systems and these other mechanisms on campus that can be supportive and helpful. So I think we've already hit this, you got it in the slide. So, and I just want to touch a little bit because I have faculty who call me and they'll be like, I have this problem, and they'll tell me like, the student told me this, and this, and I'll be like, what's the student's name? And they'll be like, I can't tell you that. Wrong. And a lot of people will cite different laws. They'll say things like, well, HIPAA, like, which is not even a thing outside of Meg's world. And so I just want folks to just be very clear of that when you're working in an education abroad program, that you have full rights to communicate to anyone who has, the language of HIPAA is legitimate educational concern, right? So we all have legitimate educational concern for any student we're working with, right? Just like if you're working with a student and you want me to do something, then you're pulling me into legitimate educational concern for wanting to help that student. Same with Mike or anybody else who's working. And so just know that you have that right. That's very different than gossiping, obviously. That's the kind of stuff we don't want to do. Or just being like, well, did you hear what my students did? Like, that's a whole different story than I'm telling you because you work for this student too, and I'm hoping together we can be helpful for the student. As long as that's kind of the overarching, philosophy behind the conversation, you have full leeway there to do that and to communicate things. And especially things that are personal and behavioral in nature, because that stuff was really never meant to be covered under FERPA anyway. FERPA is really about educational things. And someone telling you that I'm struggling with this, or not meeting curfew, or having a fight with a roommate was never intended to be included under this kind of stuff. It doesn't fall even under the purview of it. And so that kind of stuff, you especially have free reign to kind of consult with your colleagues about what could be helpful for students, things like that. Another thing that I hear from faculty, and this is a very legitimate thing, I think most professions in higher education have aspirations of confidentiality. We talk about that we want to keep things private for students, and we should absolutely do that, right? When we're talking with a student, there's things that they're telling us in confidence that are related to their academics, are related to their business as a student, and all those kind of things. That's the kind of stuff that we kind of hold to be confident and confidential. But you should never promise a student that, promise you don't tell anyone. No is always the answer to that question. Always the answer to that question. And I'm like someone they come to thinking it's going to be confidential, and I say no to that. And my kind of authority for keeping things confidential is higher than yours, and so is Meg's. And so you should always be like, well, I can keep most things in confidence, but it's only going to depend on what you say. If there's things about safety, I'm probably going to need to talk to some of my colleagues about what needs to happen and things like that. But never, never, never promise just kind of this blanket privacy or confidentiality to a student. Because one, you just don't know what's going to come out of their mouth. I legitimately, I had a faculty member call me yesterday. He's like, I just sent a student over there, but don't tell him I did. Like, okay, like that feels weird to me, but all right, because then the student called my office, she's like, my faculty just sent me over here, like, okay. But just be mindful of that when you're talking with students, and especially, I can imagine scenarios when you're abroad and you're in different settings, you're not on a campus, and so the role feels less formalized in some ways, that they might then be over-disclosing, or, some students just over-disclose always. But, there might just be opportunities for students to want to say things. And so I think it's on us to be honest with the appropriate level of confidentiality we can give them, and not oversell or undersell that. Yes?
Also, if I can add something real quick to that, one thing to realize is when you're overseas with these students, under Clery, you're a CSA, Campus Safety Authority. And under Clery, if it's an issue that's security related, safety related, things of that sort, you cannot keep it confidential. You have to report it to whatever area of the university is required to report it to.
So, one of the messages that I try to preach to faculty, whether you're on campus or abroad, is to expect mental health challenges. And I won't go into prevalence rates or anything like that, but we know that large numbers of students, about a quarter, just if you want to throw out a gross number, are struggling with some level of mental health concern. So that means that on campus you're already interacting and dealing with a lot of folks who have mental health concerns and are functioning just fine, and you have no idea. You're already working with students abroad who have mental health things they're dealing with that you have no idea about, and they're managing just fine. But just know that there are going to be those exceptions. You know, if you've been around the university long enough, I'm sure you've run into them, right? There's just some students who maybe aren't and need more support and things like that. So, you know, I think sometimes people are under a false assumption that, well, if someone has a mental health concern, maybe they won't want to go study abroad. I can tell you, working with lots of them, they do. And we do all we can to dissuade them of what that means, because they're like, I just need to get away from it all. I'm like, not study abroad, that's vacation. That's a very different thing. But you know, I think it's incumbent on people who comes up for students here is going to come up for students there. And there's just a different system in place and for managing it, and there's different ability for the student to go get their own help without you as their advisor. And that's just going to be different. So like I said, I'm not going to go over this prevalence data. If anybody's like, I'm not sure that's going to happen, talk to me afterwards and I'll tell you why it's going to happen. And another thing that I really want to kind of put out there, because I still think one of the most lingering and poisonous things that sits in the back of so many people's head is that if anybody has any kind of mental health thing, they're dangerous. Or I'll have students be like, well, they're on medication, so they must be dangerous. And I thought the medication was supposed to help. And so there is no, like, once you factor out things like being a man and other kind of simple, like, variables, like, mental health is not a predictor of violence toward people. And so I really preach this a lot about this idea of don't call me, well, please don't call me with anxiety about danger if really we're just talking about someone who's struggling and needing help. You're making a leap to something that's not based in reality. That tends to be very heavily based just in lack of exposure or to bad things that are out in the media, but definitely are not science and data based by what we know about folks with mental illnesses and folks who are dangerous. So when I come to talk to folks on campus about mental illness, I usually never talk about like diagnoses. I don't sit here and be like, so when someone has PTSD, this is what it's going to look like. If someone has depression or anxiety, because it's just not that clean cut. And I don't think that's a helpful way to kind of help people have a sense of, you know, and just have a schema around kind of what mental health is and what kind of functioning and impairment look like. And so I like to talk about it like this, in the sense that everything that we think of as kind of mental health stuff tends to just be on a continuum of behavior that we all fall on, right? At all times, we have mental health. Every one of you do, all day long, every day. You have a series of stressors that are impinging upon your life, and you have a set of coping skills that you use to manage those. And to the degree that those are in balance, we tend to do okay and have general decent well-being, right? It's when those start to shift that we have problems, where these stressors then become to outdo the coping resources that we see things like shifts in mood or anxiety or other types of problems that folks develop. And, you know, and so that's kind of how I like to help people think about it, because I think when you think about kind of, you know, how someone might progress from a place where, you know, they go study abroad here, right? They're generally functioning well, they're managing their stressors pretty well, but necessarily by traveling abroad, we have increased their stressors without any subsequent real increase in their coping skills, which again goes back to that preparation planning, like I want you to know what's coming kind of thing, so that hopefully they can do that, you know, so that when they get over there, you know, their first instinct isn't to stay out all night, but it's like, I should probably get some sleep, because I know I need to catch up, and I know what that does to my mood and help regulating all that kind of stuff. And then you can kind of see, because obviously as students develop problems, again, the reason we have these talks is that when someone's moving up this continuum, we're trying to get in there as early as possible so that it doesn't have to go further. Because there's a just large swath, I would say the majority of things, if you can get somebody, start talking to them about what they're doing for their self-care, talk about them, kind of how are you managing yourself, what are you doing, that you can really kind of right the ship in lots and lots of ways. And it oftentimes is the avoidance of being willing to have those conversations and being willing to just kind of offer some feedback and some suggestions and things like that, that I think become detrimental. So, you know, I think, you know, when we talk about kind of mild problems, you know, I don't think, you know, if this wasn't up here and I asked you guys, I think you could come up with lots of things, right? The things that we can see very easily, especially in this kind of academic environment, right? What's the most common report we get about students? They quit coming to class. very good indicator of a very, baseline of functioning, right? Like your primary life role as a student, we just took you across the ocean to be a student in this thing, and you're not participating in that. That's a sign of some kind of problem that needs some level of intervention, even if it's only like, you missed the first 2 classes of your Education Abroad program. Tell me about what you're thinking. And then these other things that you may or may not see, but you can tell if students are falling asleep in your class. You can tell if they're meeting your deadlines. You can tell if they seem to be getting along with peers in the group that you're with. These are the types of things that I think without too much trouble you can pay attention and notice. But then going back to what I was saying earlier, and being willing not to be like, I'm sure it's nothing, but let's not assume that because we know we're in this unique environment where they don't have all of their supports as well, and let's just check in about that. If it turns out to be nothing, sweet, that works out well for everybody involved. But maybe it's not. Maybe, like I said, you learn that, well, this food, I just can't eat this food, so I'm feeling really weak and tired, or whatever it may be, and then you can work with them on kind of figuring out some solutions to those things. And so, when I talk about for mild distress, because these tend to be not the things that come to mind, or BRT, or things like that, but I still think folks sometimes struggle with how personal should I get? How assertive should I be in kind of inserting myself into what's going on with them? And I would argue that you should be reasonably assertive. And like I said, and just in some ways you're giving the students permission to talk about it. You're modeling that this is something we all need to be thinking about as our own health and well-being and how we're doing things. Because even you guys as the faculty and staff traveling abroad, you have to think about how you're doing and your stress level and how you're not with the folks you're usually with. And you're eating different foods and on different time zones. And, you're kind of doing these things because, you're successful professionals and you've got to this level where you actually get to take other people. And so whether it's by luck and it comes natural or purposeful, students need that. They need that education. They need that modeling about what they can do. And sometimes we have to ask enough questions to know, well, what are the gaps that they're not doing to take care of themselves well? And so these are some ideas on your slides about things that you might ask about to kind of just get into that conversation with students to make sure that they're just doing the things that kind of bolster those coping skills in their lives so they can manage those new stressors that they're now dealing with. Moderate stress, I think, is another level, right? Usually the idea being we probably missed something in some ways. Either the student didn't reach out for help, didn't get help. Some things escalate faster than others. But there's definitely a lot of situations that we see that by the time we hear about it, we're about 2 or 3 weeks past where we needed to first learn about this. Or where the Education Abroad faculty or staff needed to intervene with the student. And it may have just been having some of those conversations, because when we start asking some basic conversations, they're like, this student's doing this, and it's really worrying me, or this, that, and the other, and we'll start asking basic questions about, well, how have they been doing? Do you know how they've been eating? How they've been sleeping? How they've been coming to class? Are they getting along? And they're like, I don't know. I just noticed that they did this. Well, we've missed a huge window there, because they saw these kind of little things, dismissed them, avoided asking the questions, and then, really kind of waited until it's something that maybe started to impact the larger group or something like that. But really just a little bit of curiosity and willingness to kind of just check in with students probably could have saved some of those problems, and we probably could have righted at least some of that going into it. And definitely when we got to the point of maybe a little bit more problematic situation, we'd have had more information to know what's going to be helpful. Because when you call folks back here and we're trying to be helpful to you, the more information we know about the student, the more we're going to be able to be like, this seems like this would be helpful in this situation. Otherwise, we're just going to be like, you need to go back to talk to students and get this information so that we can kind of figure out what that is. And so, I put some examples here again about things that, ways to talk about students. And, I think the one thing that I like to encourage people to is about being very specific when you see things with students that you're concerned about. Because it's a very different conversation to go to someone and be like, I'm worried about you. And because they can blow that off in lots of different ways, right? But I'm worried about you because you missed a class, I know you didn't do well in your first exam, and you just look tired of my class all the time. That's a very kind of different intro into a conversation about what's going on and kind of what you actually want to talk about. Then, I'm worried about you or something. So be specific with the behavior that you are kind of want to talk with the student about, because you want to know kind of what they're thinking about that, right? Like, we miss some classes, like, well, why the student? Maybe they have a very legitimate reason, right? Maybe they have some kind of stomach bug that legitimately you didn't want them in the class either. But if they don't have a good rationale, or you just kind of want to know what their story is behind it, to get a sense of how much they feel like they're able to cope with it, how much assistance they might need from you. I think it just gives you a better, sense of what needs to happen, rather than I'm just kind of like worried about you. And then I think always, the thing to remind students on any campus is that, you have to do the expectations of the course. And so I feel like sometimes, both on campus and abroad, when they learn a student maybe has anxiety, they're like, well, the question essentially is, what different standard do I hold them to because they told me they have this anxiety? And the question is none. They still have to fulfill the academic requirements of the course. But that doesn't mean we still can't have some of these other conversations about ways that they can be dealing with these other parts of their lives and things like that. And extreme distress, I don't spend a whole lot of time on that because that usually doesn't miss anybody. Everybody's like, I know what those are. Those are the big red flags of danger, of threats, of things like that, that we tend to get the calls, or it's much more of a local, immediate kind of crisis responder type of thing. So I definitely don't spend as much time there. The other kind of piece that I like to at least mention with people, kind of like Meg was saying, you put people in a situation that's very different from them, and there are a number of students who can go to a place where, it would just be easier to not have to deal with this. Maybe they kind of mess up their trip and they're going to fail, or they're going to get sent home, or kind of whatever, or they're just away from the people in their lives who bring them joy. And so they start to drift off to thoughts about very depressed places, about suicide. And so the thing I like to say most about that is that's another one of those places that I feel like faculty and staff on any campus are really hesitant to ask about. That question of, have you thought about killing yourself? And it shouldn't be one that's scary to ask, because I think sometimes people think, like, by asking, maybe you're going to put it in their head to do it. Because I ask students that all the time, and I've never had a student be like, you know what, I hadn't thought about that. That's a reasonable solution to my problem. No. So folks who are thinking about suicide are already thinking about suicide, and usually they're much more worried about what you think about it than anything. And so by you just giving them permission to talk about it, by saying have you thought about killing yourself? I mean, obviously that's usually not the first question, but when we've seen some signs there, or a lot of times the way I think this follow-up conversation happens is through writing. They'll email the professor and be like, it's just not worth going on anymore, or some kind of vague, threatening kind of thing like that. And where you have those conversations, and 99% of the time, I just said that, I don't really mean that, but it's worth the ask to find out. And there's no really good way or bad way to ask about it, other than just to ask directly about it. And just be like, is this something you're thinking about? And so I really encourage people to do that, to be very direct about it. And I think the don'ts, they seem inherently well, of course I'm not going to come across as all judgmental and stuff like that, but we hear stories of students all the time who get that. Or somebody asks them about suicide, they'll be like, yeah, and the faculty person will be like, you don't want to do that, do you? That's not a helpful response. It's a very condescending response. It's kind of like, well, that's a stupid idea. Why would you be thinking of that? And obviously the depressed student would be because my life is so bad. This is the only thing that makes sense to me. And so, having a different type of conversation with them that doesn't come across that way, I think is very important. Because most folks who are thinking about suicide actually don't want to kill themselves, usually. And it actually takes very little to shift someone off of a suicidal thought or idea. And so even having conversations with that, and kind of helping them shift off of that, and enough time to contact some other places or set up some supports, can be the thing that makes the difference. Because they tend to be thoughts that kind of come and go for people. Just kind of like, I'm sure you guys know, emotions that you have, right? They come and they go. And that's part of, and it's not different than a lot of the emotions students have that are good and bad. Is emotions come and go. They tend not to be that persistent. So asking, talking about it, problem solving with them can go a very long way. I'm not going to spend a lot of time on this just because it's so geographically bound in terms of kind of what's there and available for students. You know, there's some places you take a student where, yes, there may be a mental health clinic down the road, there may be a certain type of hospital. There's some places you'll go and they'll be like, counseling what? Or, you know, like they've never heard of psychiatry or psychiatric medications, they don't prescribe them there, they're not legal. And so, you know, I think the ultimate message there is you need to know. You need to know where you're going and what the systems are for health and mental health there, what the level of access is, what the insurance that the students have through the school provide, and just have some sense of that. And not like you have to know everything, but you have to know kind of who you would call, where you can go, you know, just have those basics of what their healthcare system looks like. And it's going to be different than ours, I can promise you that. And to have a sense of that. Because to what degree that you know 1,000 times more than the students do. And so having any kind of sense of that and to help the student kind of learning to walk into that can be very helpful. Mike, you'll talk about emergency.
Yeah. And real quick, you know, one thing, you know, with my background, I dealt with people with mental issues and
Emotional issues quite a bit when I was with the Secret Service, because many of our threats came from people who were mentally ill, had emotional issues. And, you know, when we're trained, I'm nowhere close. I'm just like you guys when it came to dealing with these people that we were dealing with. And so I understand the discomfort at the beginning of going up and talking about these things, because honestly, you're asking them personal questions. And, you know, we all have our space that we don't like to have other people invade, and we're reluctant to invade theirs. But one thing I found is that, like Josh was saying, if you start, you know, speaking to them, you know, in a terms of an equal, somebody who's caring, they're very anxious to open up, you know, many times. And you do it a couple of times, suddenly realize it's just like having a conversation with somebody else. So there's no real reason to have that reluctance to talk to them. But what I'm going to talk about is, okay, things have gone off the rails now. You know, now we've got an emergency situation. Whether you have a student who's threatening suicide, you've got somebody who's, you know, their behavior is blowing up or whatever. You know, so now we're dealing with an emergency situation. The thing I put up first, and this covers every situation like that, is what I always call think local first. You know, first of all, you want to get that student out of danger. You know, and again, this is just like you if you're in an accident. You know, if you're in the middle of the road, you know, first thing you want to do is get out of the middle of the road. You know, things of that sort. Don't immediately pick up a phone and call me. And the reason why I say that is, as much as I care, I can't necessarily help you from 8,000 miles away in an emergency situation. You know, whether it's them bleeding out or them, you know, standing on the edge of a building, you know, talking about jumping, I can't grab them from here. So, you know, first thing is take care of the student locally, get the person to safety, take care of the immediate crisis. You know, if they come to you and they say, I'm really having a problem, first thing you do is sit down, talk to them, find out what the problem is. If it's caused a situation between students, separate the students. You know, make it so that, you know, you've eliminated the immediate threat. Now after that, and this is kind of, it can flip-flop, but contacting CISI, a lot of times, in fact most times, I get calls from faculty and I'll call CISI and start a file, you know, get a case opened on them. That's fine, I have no problem doing that, and I've got them on my speed dial, and they've gotten to know me quite well because I tend to bother them a lot when we've got a case open. But one thing is when I'm talking to this, I'm talking to them by third person. You know, so basically something's happened, a student, you know, is having issues, they've related it to you, you've called up, you've related it to me, now I'm relating it to CISI. So what I like to do, what's best to do, if possible, is to eliminate my part of it as much as I can so that you can talk directly to them. Because that way, if they have the follow-up question, you're there to answer it. You know, rather than me saying, okay, well, I'll call you back in a minute. You know, and then getting some other person at CISI who I have to reinvent the wheel with. So the main thing with this is use CISI's experience, you know, the information that they have. You can use that beforehand. You know, you can contact them to find out what sort of resources you have in that area. Like Josh was talking about, one of our biggest programs are in Italy. Italy is one of the countries, and this is many countries, that don't necessarily believe in using medication to deal with emotional issues as much as we do in America. So if we have an issue like that over there, their first thing is going to be counseling, it's going to be talking, it's going to be therapy, things of that sort. And so knowing that ahead of time lets you know what to expect once you get there. So then give me a call. I'm always here to help you. People are always amazed. I put my cell phone number, because that's actually my personal cell phone number up on the slide. I'm available 24 hours a day, 7 days a week to help you out. So, and if you can't call me directly, KSU Police Dispatch, if you call them up and you tell them this is so-and-so, I'm on an education abroad program in France, Italy, wherever, they know 24 hours a day to find me. So I will always be available, or if for some reason I'm out of pocket, somebody will be available to get the phone call. So, next thing is, ensure the care of your other students. It's easy to focus on that one person. This is whether it's physical or emotional or anything else. It's easy to focus on that one person to take care of that problem. But you still got a class, over here. They still need to be cared for. Sometimes they may need some sort of explanation. They know something's going on. I mean, they probably know more than you guys do. But, they need to have reassurance. They need to be, obviously you don't want to break confidentiality, but you also need to teach them, treat them like they're intelligent, people who care about, the other student or whatever. So, be prepared to talk to them about the general situation. Like I said, be careful of confidentiality on that, but also be as open to them as you can. And kind of it's not an afterthought at all, but once things are stabilized, then you start thinking about doing the BRT report. Don't wait until it's all over. Basically, put it in, you can do updates. Even back here, we just had a case recently where we had a medical issue overseas, and they probably got sick of getting my updates, my very detailed updates. But, I wanted them to know, what was going on. Partially because at some point, any one of them may see something that I'm missing and step in and say, hey, you need to make sure this is taken care of. So the main thing with that is basically everything below the contacting us or me is getting the resources that we have at KSU to start working for you, to help you get through the problem.
I think we just wanted to end with, as you're heading out and going on the trips, I think it's important before you leave and then during the trips, before something happens, and then obviously with any student that initially as you see this, you're all successful, wonderful, accomplished, just human beings. And so, a lot of times what we do in our offices and when you're mentoring students isn't with our doctor's hats, right? It's just being a human being and talking to other human beings. And so before you leave with the students, just reminding them basic, good mental, physical tips, and just how especially, and just really calling out for students, particularly students who haven't traveled abroad, just reminding them of these basic skills on how to really stay well and be well. And then especially as you start to see signs that, maybe students are getting sleep deprived or don't appear to be eating, or just any of these little signs, just really, taking the time maybe to pull them aside as you're walking around one of the cities, or just to do a quick check-in and just one-on-one. And, and sometimes I think about in the office, there's students that, I don't really use my kind of doctor's hat. Instead, maybe that student works better with my mom hat or my sister hat or whatever it is. But a lot of these checkpoints and things Josh was talking about are really just more talking to them, one-on-one really as checkpoints. Because I think the more things we can do to, as Josh was saying, kind of check in with them before the horse really gets out of the barn or the train really gets going, the better. And so just really reminding them about good sleep hygiene and You know, and like I said, if you know ahead of time that they're on the medicine, you know, just checking in on how they're doing, or, you know, the overnight flight like you talked about, and maybe, you know, they may not listen, but at least you tried. You know, mentioning that perhaps maybe everyone should get some sleep, or seeing how they're eating. But we just wanted to remind you that you already have all these skills we're talking about. You already have all these questions to ask in your head. But we just wanted to tell you that you already have all these skills, you know, just to remind you that, and give you the confidence that you can do this. And you're already seeing all these students. We see them here all the time. They're here, and you're going to run into this. We just wanted to give you the confidence and feel like that you already have this skill set to use, just as being the successful human beings that you already are. So we would open it up now to any questions that anyone has or any experiences they want to share.
I have a question, just so I make sure I understand and clarify what something you said. I'm having a student who's going on an education abroad with me next summer. I already know that the student went on an education abroad and had a physical and mental breakdown the previous education abroad. So, and you can't tell a student, no, you can't go. So in my pre-planning, I'm hearing you tell me that I should sit down with the student ahead of time, because we're going to a resource-poor country, so they will have very limited access to both physical and mental health services.
Absolutely. And so, like, I would ask, like, what do you mean by physical mental breakdown? I think I would
I heard
like.
about it from another faculty member, so is it okay for me?
Oh God, yes, absolutely.
Okay.
Yeah, we're going to start that conversation with, I heard your last trip didn't go so well. You know, and not the concept, but I would want to know every detail you could know about that stuff. Because yeah, like, what do you mean by physical and mental breakdown? Because that obviously is very vague.
Hospitalized.
Yeah, for what?
Started out, I guess, as diarrhea, ended up in psychotic breakdowns.
Okay. So, you know, obviously, I would want to sit down with them and, like, what do they know about why they got diarrhea, right? Do they know, was it viral? Matt can talk about this more than I can. Was it something they ate? Was it something like that, right?
It was probably something they ate.
Yeah,
Probably ate street food.
Did they discover a new allergy for whatever it would be? But I would absolutely be having a very detailed conversation with them about that.
Aren't there reports from the previous incident?
There are.
Yeah, I would think so.
Can I, but
Let her have access to them.
Can
I don't have them.
Who has access?
Who's got
Well, it
it?
depends.
We can
Yeah,
get
I was gonna say. I mean, if they're in the BRT database, yeah, we can absolutely get that.
We can talk to Marshall.
Yeah. But no, absolutely. You should have every bit of that information. There's no reason you can't see every detail that's involved in that thing. And I would be absolutely having conversations. And I would be sharing, like, you should go over to see Meg and have kind of a pre-visit. And I would want to know kind of like what came out of the hospital, discharge, about what they were supposed to do, and like with the psychotic thing, did that wrap up there? Has it continued since? Have they got treatment? Are they on medication? I mean, like I said, I would be having just a very in-depth conversation about what went wrong there and what have we done or needs to be in place in this next one to prevent that from happening again. Absolutely.
And especially in a situation like that, because I think I know the one you're talking about, I would definitely make sure they understand. And this is a good message for all of your students, is don't wait until something's a crisis to tell you. Because, if it's the case I'm thinking of, they've been dealing with that for quite a number of days. And, to the point that they were broken down. Had it been one of those things where they reported it the first day, hey, my stomach's, I'm having some issues, you get them, taken care of, they probably never would have reached that other plateau, where mentally they're starting to have trouble dealing with it. So that's definitely one of the big conversations you have is, with your students, is not to wait until it's a crisis to tell you they're having a crisis.
And nothing was written on her needs assessment at all.
Yeah, which that happened, right?
Yeah.
But so that's why we're having a conversation. And we're asking very pointed questions.
But the other part wasn't, it's known, so.
Yeah.
Yeah, now it's documented.
And if you come out of that thing with like questions that like, you don't literally answer to, and you don't get a sense that the student knows the answer to, I mean, one, call me or Meg and ask, and be like, they said this, or they were on this medication, or this, and like, let's talk about that. If it needs to have a second meeting, where maybe a couple of us in the room with them, we gotta have that conversation, like, we can do that stuff. On this side of the pond, we can do lots of things to
We've
be as
done
helpful as we
before
can.
where students have wanted to go abroad, and there's been issues where there's still, no one can say they can't go, but we've met to talk about how, with the student, obviously in the room, but we've met where we talk about how to be better prepared. you know, with the student, obviously, and the faculty go.
And that's one of the messages that I give, because I put emotional health and medical health literally on the same plane, in the same sentence when I speak with students, because I think that's part of one reason why they're afraid to talk to us about it, is because we approach it sensitively. We say, if you got a broken leg, let me know. If you got depression, something like that, you know, and that lets them know, well, there's an issue here, you know. But if you sit there and you say, hey, if you got any, you know, health issues, make it so you can't walk, if you tend to suffer from anxiety or anything, let me know, we'll get it taken care of. Visit your doctor to see if there's anything you can do to help you with that, or to see if, you know, there are any coping mechanisms or medication balance that you need to help you with the other. And by saying it just as loud, just as assertively, whether it's medical or emotional, I think puts them at ease, you know, because they recognize that you're at ease.
And if you look at the file and you don't know what to ask, call us. We'll help you come up with what to ask, or we'll come sit and help and ask it with you. Seriously. Don't mind doing that a bit.
I recently had to file a BRT report, and I'm not clear as to what happens from the BRT side afterwards. I was contacted, but then I assume that I have an interest in staying in continual communication with the students involved. But what happens on the other side?
It kind of totally depends, because kind of like Mike was saying, a lot of the BRT reports we get from Education Abroad are more like FYI reports. Like, here's a situation that occurred and we're documenting it. And so, was it something that you were seeking like input or intervention on, or was it just kind of like a, here, just so you guys know, here's what happened?
No, I think I seek help.
Yeah.
And I did reach out to Education Abroad too, and I think we're still in the process of figuring it out, but I just don't know where my role stops and where I'm sort of getting to know your turf and where I'm.
So what I would say is, it's never out of your turf. Because I do think some people sometimes mistakenly think like a BRT report is like a tag. And like, they got it now, and I don't have to think about it. And that's absolutely not the case. The BRT looks at every report that comes in. And you know, the first thing we're looking for is assessment of risk and danger, because that's our primary concern with that. And then like everything else is tiered down from that. Because we honestly get a lot of reports that are, this student came to my class for 2 weeks and they never came for like 4 more weeks. And like, that's the report. And so we don't do anything with those because there's not a whole lot we can do there. And so I would say if you don't hear back from the BRT something that you think was helpful, then tell them that. Because usually it's Chris Summerlin who does kind of the immediate response. And be like, hey, I didn't get any feedback from this, or I'm still kind of listening. I would definitely send that feedback back that you didn't really get what you were kind of expecting from that. And then, he could be like, well, we really thought this was more of a behavioral management issue that needed to be worked out on your end, but that should be a clear communication. You should be wondering what the situation was.
One thing you might see with that is if a BRT report is put in, is it may seem like you're not getting a response from them because you're still talking to me, you're still talking to one of the Education Abroad coordinators. And what's happening is we're talking to them. They're saying, okay, this is a situation. And one thing that I do like to do, especially if it's a crisis, is I like to reduce the number of people who are in direct contact. Because I don't want to counteract something that Josh is saying. I don't want to say something different than Meg's saying, or we might have different amounts of information. So a lot of times we'll keep that point of contact being one person. So you may not think you're hearing from the BRT, but you are. It's just through Cynthia or one of the other program directors or me. But definitely, if you ever feel like you're not getting enough, then reach out, and we'll get some more.
Yeah, because you should never be sitting there wondering, like, what am I supposed to do, what they're supposed to do? Like that, some communication dropped there for sure.
I just wanted to clarify.
Yeah, absolutely.
It's not, it was very prompt and very professional. It's something new for me, and that's why I'm here.
Yeah, absolutely. Any questions we can answer for folks?
Yeah. Well, I want to thank everybody for coming. I hope you got something out of this. And as usual, if there's ever any questions or anything that come up later, if you need anything from us, call us anytime. And
we will get to taking care of.
Thank you.
Thank you.